Science only works if it reflects reality. There's a whole new paradigm shift away from reductionist towards systems-based science, driven by big data and AI, that is our only hope out of the health crisis hell we've created for humanity in the 21st century. The current, old paradigm is reductionism. It's based on the idea that if you study in detail each part, then you can learn about how the whole, in this case us, works. The pinnacle is the randomized placebo-controlled trial, where you have one group of people given a treatment, usually a drug, and another given a dummy pill or placebo or nothing as in a control group. Even better is double-blind, which means neither the participants nor the researchers know who's in which group. Then you measure something like cognitive function to see if the treatment works. But you have to make sure the two groups of people, placebo and treatment, are similar, controlling for confounding variables, same sex, roughly the same age, number of smokers, genetic variations, and so on. These trials can cost anything from $10 million to over $100 million if they involve over 1,000 people, for example. That's a lot of money to raise if you don't have a profitable treatment. So there's easily 20 times more trials on drugs than non-patentable nutrients. Also, to even be able to do a trial, you have to get the sign-off by an ethics committee, either within a university or, for example, the NHS. Of course, they are influenced by pharma more than nutrition enthusiasts. The so-called gold standard is where you pull the results of these RCTs together to do a meta-analysis. Imagine you have 10 such randomized trials costing $10 million each. That's at least $100 million of research. Now, who are the appointed experts that run the meta-analyses and systematic reviews? Usually people in the pay of the system that funds the research, big pharma. Guess what? They tend to ignore anything like nutrients that compete with drugs. For example, 3 meta-analyses exploring the best dementia risk reduction steps from the UK, the US, and China ended up with 3 different results. The US one reported that homocysteine-lowering B vitamins accounted for 22% of the risk for dementia, and lack of seafood, or omega-3, for a further 22% of risk. The Chinese one also reported that homocysteine-lowering B vitamins were the most promising treatment. In contrast, the latest UK Lancet Commission, despite being sent all the studies, ignored B vitamins and omega-3. So much for meta-analyses being gold standard and reductionism being the way to solve our health problems. Even if it worked, those scientists then have to persuade the politicians and bureaucrats to persuade the people to change their ways. Guess who's influencing the politicians and the bureaucrats? Big pharma and big food. No wonder we are getting sicker and sicker, with healthcare costs rising to 1/5 of GDP and taxes. No wonder obesity is widespread, as our diets keep getting worse. Sick people means more drug sales. The philosopher Marcel Proust said, "The real voyage of discovery consists not in seeking new landscapes, but in having new eyes." Let's look in a different way, called systems-based science. It turns out that every one of the risk factors for dementia affect either the structure, the function, or the utilization of your brain. Using a car analogy, it's how the engine is made, what it runs on, and how you need to use it or lose it. Our brains, for example, are made from omega-3. They need B vitamins, not too much sugar, to run, and an active mental, social, and physical lifestyle to exercise it. Talking about cars, the mission to create driverless cars using reductionism, trying to program for every confounding variable, failed. It was solved by big data and AI. When there was enough data on over 1 million drivers prioritizing 5-star Uber drivers, AI worked out how to drive very well. Data on millions of people, their diet, their lifestyle and behaviors, and their cognitive function as it changes over time. On average, it reduces from the age of 18, with too many people slipping into dementia in their 70s and 80s. The question is, who are the 5-star brainers? The people whose cognitive function doesn't decline into the danger zone. What are they doing differently? Then, in this digital age where everyone has a smartphone, we can talk straight to people to encourage them to do the same things and become 5-star brainers, dementia-proofed. That's what we are doing at the not-for-profit foodforthebrain.org with our free cognitive function test and cognition to teach you how to dementia-proof your diet and lifestyle.